Brother Brown, how you doing? This is Dr. Brown.
Good morning.
Good
I
morning.
was out and I just got walked back in the studio right in time to catch you, Dr. Brown.
Perfect timing. Perfect timing.
Okay.
Perfect
And
timing.
it is WV. Dr. Christopher Brown. Dr. Brown, but I'm putting you on the air right
Right. Thank you. Thank you. Thank you, Brother Brown. Good morning, listeners, and good morning, Brother Brown. You're locked into WVOE, the voice of Ebony, where your health is our heartbeat. I'm Dr. Christopher Brown, president and founder of Pressure MD and the Doc Brown, welcoming you to another enriching session of Health Facts, this show where wisdom meets wellness and knowledge is always in season. So today, what are we going to talk about today? So for today, what we're going to talk about is, the fact that being that it is February, we are going to talk about heart health. So February is Heart Health Month. So we're going to talk about the heart, why heart health is important, and what you can do to keep yourself as healthy as possible. Okay. So why is heart health important? So, of course, I think we all know that the heart is extraordinarily important. It's kind of that engine that keeps us going. It beats about 100,000 times a day, pumping blood to every part of our body. And so, when our hearts are healthy, we feel energetic. We can keep up with, if we got kids, you can keep up with the kids. If you got grandkids, you can keep up with grandkids, and you really can enjoy life to its fullest. But unfortunately, the truth is that heart disease is the leading cause of death in the United States. And for African Americans, like a lot of things, of course, we suffer more than other peoples. So, what causes heart issues? So, when it comes to heart issues, there are a couple of things that really put us at risk of heart disease. So, one is high blood pressure. High blood pressure is one of the leading causes of heart issues, especially heart failure in African Americans. And so nearly 55% of African Americans are affected by high blood pressure. And as we've mentioned in the show before, and we'll actually have another show in the future, high blood pressure is a silent disease. Most people do not feel when their blood pressure is high. And honestly, whenever you do feel like you have symptoms from your high blood pressure, that's usually a sign of super advanced high blood pressure that requires hospitalization to get under control. So high blood pressure is one. High cholesterol is another one. And also another big driver is going to be diabetes. And African Americans are much more likely to have diabetes. And yet again, and diabetes typically will have some symptoms especially as it advances. There are other things that can cause you to have issues with your heart. Is going to be obesity, and of course, we know there's obesity is really at an epidemic inside of our country. And around 48% of African American women, 37% of African American men face obesity, and that can also lead to heart issues. Of course, obesity also drives diabetes. Obesity also drives high blood pressure. So all these things kind of feed on each other. Other things that can cause issues with the heart, and that is physical inactivity and unhealthy diet. Yet again, everything feeds on the other. So physical inactivity, unhealthy diet can drive obesity. Obesity then drives high blood pressure and diabetes. High blood pressure and diabetes then can lead to heart issues. So this is why heart issues can become one of the things that a lot of African Americans can face. Okay, so now that we know why heart conditions are important, what causes heart conditions, you want to talk about, how do you screen for heart health? How do we screen to prevent these things that can cause issues with our heart? So high blood pressure. So getting a blood pressure check. So you probably should get your blood pressure checked at least once a year, especially if you have a family history of high blood pressure. So you might have a blood pressure that's normal, at 25, but a lot of times when I see people, they may be 35, 40, and, they haven't had their blood pressure checked in 5, 10, 15, sometimes 20 years. And so this is one reason why you want to get your blood pressure checked on a regular basis. And it could be some people just, if they don't have a clinician, you can actually go to, sometimes a CVS might have one of those blood pressure machines back there. You can put your arm in there and it'll tell you if the blood pressure is high or not. If there are any health fairs, you can go there and you can get your free blood pressure check there as well. And my understanding is that if you go to a fire department, a lot of times they'll check your blood pressure as well. So make sure you get that blood pressure checked at least once a year. And of course, if it's elevated, go seek care so that your blood pressure can be controlled so that you don't put yourself at risk of heart disease. Okay. Of course, cholesterol test, this is a blood test. And so you need to, have your clinician to write a prescription or an order so that you can get your cholesterol tested on a regular basis. Blood glucose test, yet again, early stages of diabetes sometimes can be asymptomatic. Also, there's a condition called prediabetes where you're at risk of diabetes. And that is something that you can also check with blood work. And the thing is, especially for prediabetes and diabetes type 2, these can sometimes be reversed, especially prediabetes. If you get diagnosed with prediabetes, your clinician should be talking to you about, weight loss through diet and exercise, because losing weight, exercising more, and eating better can actually reverse prediabetes. I've seen it. I've done it. I've written, exercise prescription for patients in order so that they can be reminded that they need to exercise on a regular basis or that they need to eat better. So this is a condition that can definitely be reversed if you get it caught early enough. Okay. Then, of course, BMI. So, when it comes to obesity, the way we categorize this is through what we call body mass index, or BMI. And so that's a combination of your weight and your height. And they have a special calculation to help you do that. And so these are ways that you screen for conditions that lead to issues with your heart. Okay. Now, if you have symptoms, there are things that clinicians can use to diagnose heart issues. And so if the doc suspects a heart problem, or you having some condition where it may be chest pain or shortness of breath, things of this nature, there are certain things we can do in order to help diagnose the heart issues. One is something called an EKG. And so what an EKG is, it actually measures the electrical activity of your heart through a number of sensors that we put on your skin. And so taking a look at that, we can actually tell whether or not, especially if you've had a heart attack, and sometimes people have silent heart attacks, or if, like I said, if your heart is stressed, we actually can tell these things through what we'll call an electrocardiogram. It also measures the electrical conductivity of the heart, so that if your heart is skipping beats, we can read that on there as well. Another thing we can do is called an echocardiogram, and this is an ultrasound of your heart to see its structure and its function. So similar to, when women get an ultrasound of the baby and you can see what's going on with the baby, you can actually do that with your heart. We can actually take a look at the heart while it's beating and see if it's beating the way it's supposed to. There are valves in there we can take a look at and see if those valves are functioning properly. Sometimes those valves actually become leaky, and that can cause heart issues as well. So an echocardiogram is an important test that can be done. A lot of times the doc will actually listen to the heart, and they can actually hear what we call murmurs, and that can be an indication for getting an echocardiogram. Other things you can do are something called a stress test, and this shows how your heart works during physical activity. And so, one of what we call the simpler stress test is where they actually put you on a treadmill. They attach leads that are similar to the electrocardiogram, and they have you exercise. And they look at the leads, and they can tell whether or not that heart is stressed or not. I'm not sure if, I know the Cosby Show is not running anymore, but if those of you that watch the series, if you remember, Dr. Huxtable at one point in time had to take a stress test while he was on the show. And of course, it was, quite humorous, but it was an accurate demonstration of what happens whenever we do a stress test, which is basically, you put on the leads, you put a person on the treadmill, and, you start out walking, and then they speed it up a little bit. and then we see how your heart, we see your heart tracings to see whether that heart is under stress. So that's a stress test. They have other stress tests as well that are a little more sophisticated, but that's, kind of one of the simplest one. Nowadays, they actually have things they're called cardiac CTs or an MRI, and these provide detailed images of the heart, and they also provide detailed images of the blood vessels that actually feed the heart. So that's another thing that can be done as well. And then what we call our gold standard. And this is the test that really tells whether or not those vessels inside the heart are functioning the way they're supposed to. And that's called a coronary angiogram. And that's when they go in and they actually put a little a lead up to the heart, and they use dye to take a close look at the vessels that are feeding the heart. And like your heart is beating. It's a very sophisticated procedure, but your heart is beating. They put some dye in there. They actually see as the blood flows through the vessels to the actual heart, and they look to see if there's any narrowing or if there's been any signs of actual damage, and they can see all this through the angiogram. In addition to that, they can also tell how well the heart is beating. So they will, put some dye in there, and then actually tell how much of that dye is being squeezed out and estimate how well that heart is beating as well. So those are some of the ways that we diagnose your heart issues. Then, of course, you got, I like to talk about, the clinicians involved, because one thing that I've noticed is that a lot of times people don't really know, who they should go to when it comes to issues involving, heart, lungs, whatever. So I always want to make sure that you know who to go to. So the first person that you should check out is going to be your primary care physicians or primary care clinicians. They're your first point of contact in the healthcare quote unquote system, and they can help manage a lot of issues. They can help do a lot of screening. They can do a lot of education. When you need it, when you need a cardiologist or a specialist, they can help you to select which one to go to. And so that's one reason why I really emphasize the importance of primary care physicians. Yes, I'm a specialist. I'm a kidney and hypertension specialist, but I really believe that the majority of people need to make sure that they have a primary care clinician, a primary care physician as their first point of contact, with the healthcare system. Okay. So that's primary care physicians. They'll take a look at you. They'll make sure everything's going okay. And they'll get you the specialist that you need. So cardiologists are doctors who specialize in heart health. So like I'm a nephrologist and I focus on kidneys and hypertension. The cardiologists focus on heart health. They also do hypertension as well. But like I said, what they're really known for is focusing on heart health and making sure the heart's functioning properly. So a lot of times if a person has, some chest pain, they may go to the primary care physician or primary care clinician. They may do some screening tests there and sort out whether or not, do they think it's the heart, or they think it may be something like heartburn or something of that nature. And if they're concerned enough, they'll get you to a specialist, which would be the cardiologist. The cardiologist will be more focused on making sure that heart is okay. So a lot of times they're the ones that do the stress test. They're definitely the ones that do the coronary angiograms. So that's the group of doctors. That's the specialty that you would look for issues with your heart. Okay. In addition to that, like I said, there are other people that also can be involved in heart health. So they're nutritionists and they're exercise physiologists. And these are people, nutritionists are people that help you to analyze what you're eating, help you to select, the proper foods to eat that can kind of help your body to really heal itself, honestly, and to maintain its health. And then exercise specialists can help you to design safe exercise programs for heart patients. And of course, if you, like I said, if you are trying to work, if you haven't been active and you're trying to get started, or maybe you have some other concerns, they can help you to craft safe exercise programs for you. So these are some of the clinicians that are involved in making sure that you have, that you're safe and that you're doing the things that need to be done in order to protect your heart. Now, of course, if you want more information, you can always go to, of course, go to my website. So www.thedocbrown.com, and that's THEDOC Brown, BROWN.com. So thedocbrown.com. Also, that there's also Pressure MD, PRESSURE, MD, Pressure MD, focusing on high blood pressure, early stage kidney disease. And in addition to that, you can always go to your local health department. Kind of emphasize this a lot in my talks, and that is, the importance of the local health department. And even if they don't have a clinic or anything of that nature, they often have connections to either the local hospital, or they might know different clinics that are around there. And so a lot of times you could go there to your local health department, say, hey, I'm looking for a primary doctor. Hey, I'm looking for a cardiologist, and they can point you in the right direction. So always remember your local health department. And so these are some of the resources that you can go to in order to find a little bit more about ways to keep your heart healthy. And so that's pretty much it for today. So yeah, just wanted to cover the issue of heart health. Make sure that everybody out there is knowledgeable about why heart health is important and how to keep your heart healthy. So this is one of the things we want to focus on. And one of the reasons I want to talk about that is because, a lot of diseases that affect us, especially these chronic diseases, can sneak up on you over the years. So a lot of things, like I said, diabetes, you can't feel that early on. Hypertension, you can't feel that early on. And even with heart disease, when I mentioned that hypertension can cause, heart issues, one of the issues is heart failure. So you could have high blood pressure, which you can't feel, and it lasts for a long time. And if it lasts long enough, it can actually cause what we call congestive heart failure. And this is where that heart muscle just kind of gets weak and doesn't pump as well. And the problem with that is that when that happens, you may not feel this, but at some point in time, you may notice things like, you're getting more tired than usual, you're short of breath, your legs may start swelling. Well, when that happens, that's usually because, that heart is already weakened. And now you got to get everything under control. You go to the emergency department, they send you to the hospital. Next thing you know, you're in the hospital for a week, 7 to 10 days while they do, any number of tests. They got to check out the heart, make sure that's okay, make sure your blood pressure is under control. And I see this a lot because I'll see the person and they'll be like, oh, I was fine, this, that, and the other. And not knowing that, they hadn't seen a doctor in 20 years. And now they've gone from not having any meds, to walking out of the hospital with sometimes it may be 5, 7, sometimes 10 medications. And now they're kind of overwhelmed and they're frustrated. And so this is one of the reasons why, why I started The Doc Brown and why I kind of collaborated with WVOE so that we can get the message about taking care of your health and getting screened and getting treated before you have to go into the hospital to get things taken care of. So that's kind of the talk for the day. So like, as always, want to check with Brother Brown to see if he has any questions or concerns.
Yeah, Dr. Brown. Things. I'm not disagreeing with you, but I think that would depend on a number of factors. If your heart is not healthy, or your age, and if you've had problems before, you should have that heart checked a little bit more often than that. And you should also see your cardiology at least every 6 months. But I've been a patient of congestive heart failure.
So I'm glad you asked that because so let me clarify. So when I say these once a year, this is for people that don't have other conditions. So like if you're a 25-year-old person, you haven't seen a pediatrician and you go to your and you're not used to, you go to your primary care and they check, your blood, your blood sugar, your cholesterol, your blood pressure, and all your stuff is okay. Those are the people that can see a doctor once a year, maybe once, every 2 years. If you've diagnosed with congestive heart failure, or if you have a diagnosis of high blood pressure, high cholesterol, you should be seeing your doctor more than once a year. So you're absolutely
Yeah.
right, Brother Brown. And so I'm glad you asked, so I can clarify this so that people don't think that I'm saying that if you have even high blood pressure that you should be seeing somebody once a year. You know, you should be seeing your if you have a medical condition, a medical diagnosis, you should be seeing your doctor more than once a year. So high blood pressure, you know, like I said, usually about every 3 months. Once it's stable, it may be, you know, you may be seeing them about twice a year, but that
Uh-huh.
doctor should be seeing that. But yeah, if you have a diagnosis, high blood pressure, you know, pre-diabetes, high cholesterol, and you have not seen your doctor in the last 6 months, you need to call and make sure that, you know, something hasn't changed, the office hasn't gone, you know, hasn't changed or something of nature, and make sure that you have an appointment. So if you have a medical diagnosis, you should always have an appointment set within the year, within the
Okay.
really within the year. So thank you for asking that question so that I can make sure that I'm clarifying for people. So
Yeah.
people aren't going out there saying, "Oh my God, Dr. Brown says I only need to see people once a year." No, that's for the healthy folks. Okay, if you have a medical condition, you should definitely be seeing your medical
Yeah.
clinician, your doctor. You know, like I said, you know, more than once a year. Just ask them how frequently they need to see you. Okay.
Okay, because once when I had a congestive heart failure, and I didn't think there was anything wrong with me, and then I had to get, I couldn't breathe good,
Mm-hmm.
so I had to go to the ER.
That's it.
And when I got there, my oxygen level was down to 49.
Woo, man.
And
Yeah. Yeah.
they told me if you'd been there a little bit longer, you'd have been at this man.
Yeah. Exactly. Exactly. And so, and actually, you know, yet again, you know, you're highlighting something. The body is an amazing, it is just amazing. So
Uh-huh.
you can tolerate a lot of things because yet again, if your oxygen level is down to 49%, you know that tells me that you probably is been whatever's going on was going on for a long period of time, and your
Uh-huh.
body just adjusts to it. So your body will adjust to it, and you may not feel it as much.
Right.
But like I said, at some point in time, that stuff will catch up with you. So like kind of like I said, if you'd have said, you know, I feel, you know, I'm gonna go, you know, drink some tea or something and go and lay down, you know,
And I'm all right. Yes.
you probably would not have woken up at 49%.
Okay.
Yeah, so that's why people have to go, you know, when they get them symptoms, go get it checked out, find out what's going on. And I'm glad you went to the ER. So I'm glad you went to the ER.
Yeah.
Okay, excellent, excellent. Okay, that's good. That's good. That's good. So keeping an eye on that. So that's a way that a patient can or a person can be empowered and be part of their health journey.
All right. Right. And
Mhm.
thank you so very much.
All
That
right.
was great, man.
Well,
A lot of people don't, but you need to know about that heart
they do.
thing.
They do. They
We
do.
don't get but one shot with that
There
sometimes.
you go. Exactly. Exactly. Because it can take you out the first time you have issues. So
All right. Yes. Thank you, Dr. Brown.
thank you, Brother Brown. Take care, and I'll chat with you next week.
All right. Thank you very much. God bless.
God bless.
And this is WVOE 15.